Yeah. Audio.
Hi, everyone. We're having a few technical difficulties, but we will be right there with you. We're just trying to fix the sound right now. Apologies.
So my name is Alicia Jasmine Harper. I am a native resident in Newark, New Jersey. I went to high school at St. Vincent Academy, and then I received my Bachelor of Science from William Patterson State University. I love being a mom. I'm so glad these two chose me to be their mom. It's definitely challenging having twins. So this is Arby Jasmine, and then I also have Ava Joy. They are fraternal twins. I was relatively high risk. I had several large fibroids. Had really hoped that I was going to have a better experience and not have to kind of just almost find myself being like a clog in the system. I felt like there were times where I was asking questions where I wasn't even like given concrete answers. I know as I got later into my third term, I'm like, hey, I already knew I was going to have a cesarean section, but I was like, when are we going to schedule this? And they kind of wanted to wait up until the last minute. I felt like to actually, put it on the books. It just so happened that at an ultrasound, this young lady wasn't faring too well, and we ended up having to kind of do it like an emergency C-section. So I just really hope that people kind of change the almost discrimination of how Medicaid patients are cared for. So we have really limited resources and then in terms of where we can receive care. And I wish that there were some maybe private doctors that I wish would accept the insurance, because it just would give us, more alternatives and better options. So I would just say not seeing us as, just people who are receiving state care, see us as individuals. I'm a person who I have a full-time job. I'm well educated, but there were definitely times where I felt like, there was almost like this stigma attached to me because I'm, a Medicaid patient.
Ajane?
Good morning, all, and thank you so much for joining us here today. I just want to thank the First Lady, Tammy Murphy, and all of Nurture NJ, the whole team, for inviting me to be here for this monumental event. I'm sorry, I'm just a little teary-eyed just watching the video. I have so many similarities to her story. I'm honored to be here and to share my story with you today. The healthcare system failed to give me the quality of care that me and my son deserved. But sadly, this is what happens to so many other Black women across the nation, especially here in New Jersey. I'm hoping that this initiative can change that. In 2019, I was blessed to receive news that I was expecting. While I had a flood of emotions, I was also terrified because at 21 years old, I wasn't in the most financially secure situation. I was a full-time student and working at TJ Maxx while my boyfriend was continuing his education and working per diem at Morristown Medical Center. I started prenatal care at a private facility and received health care that was warm and prompt. But it wasn't until I started receiving the bills from the blood work, genetic tests, and ultrasounds when I realized that my mother's health care did not include maternal care. My family helped me in the beginning of my pregnancy, but after a couple of months, my mom told me that I had to find a way to make it on my own, and I had 5 months to find my own place. So I couldn't continue to receive care from the private facility because they didn't accept Medicaid. I had to scramble to try to find another healthcare facility that did, while most places in my area were backed up 4 to 5 months. So I had to go to clinics. The clinics were also filled, and the wait time would be up to 2 hours. The doctors would be reading my chart on the way into the room. It wasn't the type of care that I was used to. I quickly understood that they didn't care about giving me quality healthcare services because they didn't even care enough to know my name. They were overworked and understaffed, and the physicians, nurses, and staff just wanted me in as quickly as possible, in and out as quickly as possible. Around 12 weeks into my pregnancy, I started to have really intense pain. And whenever I told the doctors, they would brush me off. Their attitudes towards me got progressively worse every time I alerted them to this pain. And I heard things like, that's just new mom jitters. Your pain is normal. And that's just ligament pains. But I knew that it was much more than that. I suppressed my intuition because I trusted these doctors and nurses. I went into preterm labor at 19 weeks, and I was met with immediate judgment when I handed the nursing assistant my Medicaid card. I sat on a bed for an hour and a half before seeing a doctor, who then determined I was having contractions. Again, I asked, was there anything that I could do to stop the pain? And I was told to drink more water and that my pains were normal. 2 weeks later, I went into labor, but I was so accustomed to being in agonizing pain that I endured labor and a placenta abruption at home. When I finally got to the hospital, I was 10 centimeters dilated and needed an emergency C-section. I couldn't see my son come into this world, and I watched him struggle for survival for 3 days until he passed. I wish I would have known what I know now. I wish I would have demanded those tests and better care, because I knew that the pain that I felt was nowhere close to being normal. The pain will never match the aching in my heart that I will feel for the rest of my life. I share my story so that other young Black moms know that their voices deserve to be heard. And when you think something is wrong, don't ever let someone silence you. Thank you. And I'd like to turn it over to Miss Tammy Murphy.
God bless you, Ajane. Thank you. Good morning, everyone, and thank you for joining us. Ajane, thank you so much for sharing your story with us. It's never easy to speak publicly about something so personal, and there really are no words to express how grateful we are for your bravery and generosity of spirit. You have been and continue to be a powerful advocate and inspiration to us all. And I'm so proud to count you and every single one of the incredible women speaking today as a partner to Nurture NJ, as well as all of you who've joined us for this program. With over 700 people registered for today's press conference and hundreds more watching across our social media platforms, this in itself is a sign of the incredible amount of support and enthusiasm behind the release of the Nurture NJ Maternal and Infant Health Strategic Plan. Indeed, your participation and partnership today is an endorsement of our overall mission to make New Jersey the safest and most equitable place in the nation to deliver and raise a baby. Today, I hope you will take from this program the importance of that word partner, both in the effort it has taken to develop this plan and in its implementation as we move forward. Because move forward together, we must. Last year, on Maternal Health Awareness Day 2020, I shared that our maternal and infant health crisis was not only urgent and disturbing, but insidious, extensive, and racist. Here again are the haunting statistics. In New Jersey, a Black mother is 7 times more likely than a white mother to die from maternity-related complications. A Black baby is over 3 times more likely than a white baby to die before his or her first birthday. Last week, in his inaugural address, President Biden spoke of a cry for racial justice some 400 years in the making, a cry that can't be any more desperate or any more clear. I have spent 3 years listening to this cry grow louder from Black mothers who have lost their babies, or very nearly their own lives, fathers who have lost their life partners, and countless women of color who have told tragically similar stories. Stories of not being listened to or receiving the care that they needed and deserved, at a time when they could not have been more vulnerable. And as we have worked to raise awareness of this crisis, I have seen New Jerseyans from every corner of our state respond, some with shock and outrage, others with sadness, but all with a determination to raise up these collective voices and demand an answer to their plea for racial justice through reproductive justice. Today, we are answering that call. This plan is the culmination of over a year of innumerable conversations with over 100 stakeholders, ranging from departments and agencies, health systems, physicians, doulas, community organizations, and most importantly, to mothers and their families. It is designed to make transformational change in a system that has historically failed our mothers and babies of color. At its most fundamental level, the plan meets the specific needs of women in their local communities, where they live, work, worship, play, and love. The recommendations are from increasing prenatal care and support for women of color to creating a groundbreaking maternal health research and innovation center. And it makes broad reforms aimed at dismantling the structures that for generations have prevented women of color from living in environments that provide the resources needed to simply be healthy. The goal, to reduce our maternal mortality rate by 50% over 5 years and eliminate the racial disparities in birth outcomes, will require all sectors, health, education, business, government, academia, and more, to play an integral role. And ultimately, the success of this plan relies on our active partnership and collaboration. I must warn you, the work outlined will not be easily or quickly accomplished. But with our collective and persistent commitment, we will root out the institutional racism that has affected every corner of our society, all the way to our mothers and babies. Our country is at a crossroads. I do not say that with fear. I say it with the utmost sense of optimism and hope for what we can achieve together. I consent that some of you may be listening with skepticism. But President Biden on Wednesday, speaking about the nature of the American people, also said, through civil war, the Great Depression, world wars, 9/11, through struggle, sacrifices, and setbacks, our better angels have always prevailed. In each of these moments, enough of us have come together to carry all of us forward, and we can do that now. As we come together to face our nation's racist past and present, where better to start than where life starts, with our mothers and babies. When we do this work, we do it for the tens of thousands of mothers and children we will never know. But we also do it for our own mothers, our own children, our grandmothers, aunts, nieces, and friends. We do it for those who are no longer with us and for those who have yet to be born. We do it because we are ready to turn the page to a future where every family gets off to a healthy and happy start. And now we have a plan to get us there, a blueprint, not only for New Jersey, but a blueprint for tackling systemic racism across our country. So I want to again express my gratitude to all those who contributed to the development of this plan. And I want to give a special thank you to the women of color who shared their deeply personal and painful stories with us. Your voices are the backbones of these documents. And it is our responsibility to listen. It is our responsibility to listen, and it is our duty to act. At this time, I would like to introduce Dr. Diane Rowley, one of the lead architects on our plan. And she is not unfortunately able to make it today, as she is, confusion. I was originally going to introduce Dr. Vijaya Hogan. I apologize. She is the lead architect of our plan, and she is not able to join us today because she is with her granddaughter, waiting her next grandchild. So luckily, Diane Rowley, one of our brilliant consultants who worked on the development of the plan, is here with us. So I would like to, with that, welcome Dr. Rowley.
Good morning. Thank you very much. Dr. Hogan asked me to represent her today. This morning, her daughter-in-law went into labor, and because of the COVID-19 restrictions, she has to look after her 2-year-old grandchild. So let's get started. I hope I can get the screen share going. I'm a pediatrician, a professor, an epidemiologist, and a mother. In the early 1990s, I assembled the first group of epidemiologists and researchers that focused on identifying and tackling the root causes of health disparities and excess deaths among pregnant women and infants of color. My focus on health equity has continued throughout my career. The aim of Nurture New Jersey is to become the safest and most equitable place in the nation for women to give birth and raise a baby, and to provide a place where Black women and women of color are not more likely to die in childbirth. The strategic plan was developed to ensure that all mothers and babies are literally nurtured in environments that are safe, supportive, with all the needed resources to be healthy. The plan was developed by a team of racially diverse women with a broad set of knowledge and skills who work throughout the US. The team integrated the scientific literature with community voices, with discussions with state government agencies, the private sector, and a variety of other stakeholders to create an innovative approach to reducing maternal and infant deaths and to eliminating racial inequities. We discussed the plan with the communities affected by the inequities. The benefit of integrating all of these voices and perspectives is that it gave us an opportunity to center the plan on the needs of populations experiencing the most adverse outcome, women's ability to be healthy. We ask a few fundamental things. First, make a visible commitment to Nurture NJ. Please read the strategic plan and then become actively engaged in owning the plan and making it even better. And please actively build the New Jersey that the plan envisions. President Biden said, rebuilding our democracy requires all of us.
We're incredibly grateful for your work on the plan, and we thank you so much for joining us today. It is now my honor to introduce our Lieutenant Governor, Sheila Oliver. As our Lieutenant Governor and as the Commissioner of the Department of Community Affairs, Sheila Oliver has been an incredible advocate and ally to the women and children of New Jersey. The input from Sheila and her brilliant team is embedded throughout the plan, and we are so grateful to have her with us this morning.
Thank you so much, Tammy, for the introduction, and good morning, everyone that is on this call. As I listened to Ajane and Alicia earlier, I thought about that old African proverb, the hand that rocks the cradle guides the nation. And I think that if we think philosophically, that is why this is such an important public policy issue, such an important health issue. And really, in the context of equity, this too is a civil and human rights issue. During the period of time, I think that Congresswoman Watson Coleman will remember when the both of us were in the state legislature, we had to fight to give assistance to OBGYN physicians who found themselves having to leave New Jersey because of the high cost of acquiring insurance. Often we think that it is just about the healthcare delivery, but it is a broad and complex system that requires reform. I live in the city of East Orange, and I can remember probably about 8 or 9 years ago, receiving a phone call from the last remaining OBGYN physician in the city. a city of 78,000, a city that is 90% African American and Latino. We experienced in our urban communities across the state the closure of hospitals in urban communities. As a result of that, we then had a whole population of women who did not have access to any type of health care located in the community in which they live. I've heard from physicians through the years that because there wasn't access to local care, many women found themselves missing prenatal care appointments, having problems with transportation, getting to places where they had to get care, and just not being able to follow through in taking care of themselves. I'm also reminded of all the debates we've had through the years in terms of high school curriculum and whether or not young people in high school in their health and phys ed curriculum should be educated around reproductive health and, understand. I said, what are you doing that for? And she said, I don't know, I'm bleeding. Can you imagine that there are women being reared in this state who don't even have knowledge to know about their menstrual cycles and the significance that that has? That is why the work of Nurture New Jersey is so important. We have to advocate for better health care in underserved communities. We have to remove the stigma of, as Anjanae described to us, because she is a Medicaid patient or because Alicia was a Medicaid patient. Doesn't matter. All of that has to be taken out of the context of our healthcare delivery system. And lastly, one of my pastimes, particularly during this pandemic, I was introduced to watching Netflix. And one of the most popular shows that I watch, and I generally will watch 1 or 2 episodes during the course of the week, is a BBC, that's the British network. There's a program called Call the Midwife. Call the Midwife takes place in the 1950s in the East End of London, which was an underserved community at the time. People living in crowded tenement type situations, but at least the British government, dating back to the 50s, began to understand the importance of a nationalized health system, and it particularly focused on supporting women. Any woman who became pregnant was assigned a nurse and a healthcare professional, a midwife, and they did home visits to check on the mom and help the mom through the delivery process. Tammy, that is why it was important when you created and supported the evolution of the doula system in New Jersey. Because as I watch some of those midwives on the show, it reminds me of the doula system that we have created here. But what's more important is not just the fact that this program exposes what it is like for midwifery and the delivery of babies. It is the individual stories of the women who are delivering babies and the challenges that they have. They have other children. They may be in a domestic violence situation. They may not have a lot of income coming into the home. We have to begin to humanize and support women, reproductive health, and the nurturing of babies, particularly babies of color who are born into New Jersey. At DCA, we understand that as the state's public housing authority, we have an obligation and much to contribute as well, because we have to continue to advocate for safe, sanitary, affordable housing for families, because there's nothing worse than a mom having to come home after having delivered her child, not being able to live in a very supportive environment. So I want to congratulate everyone that has worked on this plan. Particularly, I'd like to give a shout out to Dr. Kimberly Holmes from DCA, who has been our representative, working along with the First Lady and her team. And just know and feel good that this work is going to benefit significant numbers of Black women and other women of color across the state. And Ajane, you touched me deeply, and just know that our hearts are with you. Thank you.
Bravo. Thank you so much for your support, Sheila. I've said this before and I will continue saying it. Your work as an elected official makes it clear that we need more social workers in positions of authority. What compassion. Thank you. I now want to welcome one of our most supportive partners at the federal level, a fearless champion and advocate for New Jersey's mothers and babies, a dear friend and trusted advisor, Congresswoman Bonnie Watson-Coleman. Welcome, Congresswoman.
Thank you very much. Thank you for inviting me. It's an honor to be here today, and it certainly was enlightening to hear about the strategic plan, even though I did have an opportunity to look it over a little bit last night. It's great work that is being done. It's always good to be with my former speaker, and her eloquence and her brilliance, and she always has a proverb to share with us whenever she speaks. This is a very important moment. New Jersey is not alone here. It's the United States of America that has a very poor standing against comparable developing nations when it comes to these issues. And it's a very complex issue. Aisha and Ajane, your stories touch my heart. You happen to be on Medicaid, but that is not the only reason or possibility as to why your situation was as it was. Because we know that even given for equality of economic and educational and social equality with other women, Black women still die to a greater degree, have issues to a greater degree, and lose their babies within the first year to a greater degree. So we know that you can't look at one institution and think that we can settle this issue. And that is the brilliance that Tammy Murphy has brought to this. We understand that this is a whole of government issue. And while you all are doing things that I believe are going to be modeling for the nation, we got a responsibility on the federal level as well. As a member of the Appropriations Committee, I'm happy to report that we are putting more resources into asking the questions as to why is this happening, making sure that there are more resources going into the communities. There are no less than 40 bills right now in the House of Representatives dealing with these issues. And with regard to it being specifically related to healthcare, those bills are like the Healthy Mom Act that I sponsored that allows a woman to select her healthcare plan when she finds out she's pregnant so that she has the plan that she needs. The Mama Act, which fosters the partnerships that you're talking about between public and private health leaders to develop best practices and to eliminate preventable maternal mortality, because we know that over 90% of the mortalities could be avoided if we did some of the things that we need to do. And the Maternal Care Act, which would create grants, very important issue here, grants, to train providers to avoid implicit bias and to help connect and integrate maternal care for those who are enrolled in Medicaid. And the Mommies Act, which I am sponsoring, is Cory Booker's bill to improve Medicaid's maternal coverage by extending it to a full year after birth and expanding access to doulas and more. So But there are other things that we need to work on. And as Lieutenant Governor said, it's ensuring that we have safe, sanitary, acceptable, adequate housing. It's that we have equal opportunity and non-discrimination when we deal with labor and education and economic development. All of those things play into the healthy outcomes. And not the least important is ensuring that we are supporting more people of color getting into education and coming out and working in the healthcare industries as providers, et cetera, so that there is a diversity of providers who deal with the diversity of patients. And I guess last but not least is that we need to have a very serious conversation on institutional racism and what does that mean? Because unless we can get at both the explicit and the implicit biases that exist within our institutions, then we're going to be missing the mark. Because I believe that we need to educate people, we need to inform people, we need to serve people, and then we need to hold people accountable. So I'm excited, Tammy. You have had this as from day one. This has been an important issue for you. We're fortunate to have you. We're fortunate to have this Murphy administration. And now we're fortunate enough to have Joe Biden as president, who understands how important these issues are. Let me just close by saying, I work with Rosa DeLaura, who is the new chair of the Appropriations Committee. I'm on her subcommittee, which is Labor, Health,
Bonnie, I think we lost you.
moving forward. Thank you, and God bless every one of you and the work that you've done.
Thank you so much for your support, Congresswoman. We are so grateful to have you in our corner. I would like to welcome our final speaker, Nastasia Davis. Dr. Davis, an RN, International Board Certified Lactation Consultant and Executive Director of the Perinatal Health Equity Foundation, has not only been an incredible resource to her patients, but to so many mothers across New Jersey. I was so grateful to welcome her to our Ask an Expert series on Facebook Live several months ago, and am thrilled to have her back. Welcome, Dr. Davis.
Thank you so much for the introduction, First Lady Murphy. I am honored to be here today to tell the story of the life of Janaea Nellums on behalf of her husband, Aaron Nellums. Janaea had a high risk but uncomplicated pregnancy. And on December 12, 2020, Janaea welcomed their fourth healthy baby boy via vaginal delivery at Virtue Memorial Hospital in Mount Holly, New Jersey. They named him Asan. Baby Asan joined his three older brothers as a member of the A team, a nickname given to the boys by their father because all their first names begin with the letter A. After discharge, Janaea began to experience severe leg pain and was readmitted to the hospital. Shortly after her readmission, Janaea passed away from hemorrhagic shock just 2 days before Christmas. According to the CDC, 60% of all maternal deaths are preventable. Janaea's death may have been preventable. Black women in New Jersey are 7 times more likely to die from pregnancy and birth-related complications than white women. This is a crisis. Although action has been taken to change the sad fact, Janaea's story is a reminder that we still have so much further to go. The recommendations put forth by Nurture New Jersey and by the Black Mamas Matter Alliance have provided a solid framework for moving the needle forward. We must implement them to make a difference for New Jersey moms and birthing people. There are 3 important points I want you to take away from Janaea's story. The first is that healthcare providers and facilities that are causing harm need to be reported and investigated. You can file a complaint with the New Jersey Department of Health on their website. If you are being disrespected, lied to, have suffered a negative outcome, or were harmed in any way, those responsible need to be held accountable. The second is that the public needs transparency and accountability. Birthing families have the right to know what happens in the birthing facilities to make an informed choice about their place of delivery. When there is a negative outcome, the public deserves to know what happened and what they did to fix it. Lastly, it's time to improve the quality of care being delivered across the state. There are numerous patient safety bundles that would help providers to properly recognize and treat life-threatening emergency conditions like severe postpartum hemorrhage. Hospitals across the nation have reduced their maternal morbidity and mortality rates by mandating and implementing these bundles, and I'm confident that New Jersey can do this as well. You can help make an impact right now by sharing Janaea's story and using the hashtags Justice for Janaea and Janaea Should Be Here. Additionally, we encourage you to match our commitment to the vision of Nurture NJ by signing the letter of commitment found on their website, www.nurturenj.nj.gov, and follow the hashtag NurtureNJ to stay connected to the movement. Finally, you are invited to join us for a virtual webinar on Tuesday, April 13th during Black Maternal Health Week, where we will discuss actionable steps we're taking right now to change the maternal health status for Black women in New Jersey. Janaea's full story, along with our action plans, can be found on our website, www.perinatalequity.org. Janaea should still be here. Enough is enough. Join us to take action now. Thank you.
Thank you so much, Dr. Davis. New Jersey moms are so lucky to have you as a resource and an advocate, and clearly we'll all remember Janaea. I also want to thank you to Aisha and to Ajane, and to all of our speakers this morning, to the Nicholson Foundation and the Community Health Acceleration Partnership who funded the plan, to everyone who has worked so hard to put this plan together, to all of the mothers and allies who have spoken out in support of this cause, and to every single one of you who is with us this morning. I thank you for your attention and thank you for your concern. I truly feel the momentum growing behind us, and I know that together we will make New Jersey the safest and most equitable place in the nation to deliver and raise a baby. Okay. I think we have some time for a few questions, if from the media, I assume, but if anyone else is listening today and has a question, please, email nurturenj@nj.gov, and we will, if we don't answer you right now, we'll get back to you. Okay, so the first question. Oh, yes. Okay, go ahead.
Hi, First Lady. Sorry, it's Shannon.
Hi,
we're going to be having the first question coming from June Gray from Children's Futures. June, I'm unmuting you right now. Please ask your question.
Good morning. Can you hear me? Can you hear me?
Yes, we can. We can hear you. Welcome, June.
Good. I know that you're going to be providing education to the providers to reduce disparities in perinatal health. But how are you going to be holding them accountable so that they're being able to treat Black and brown women with respect and being able to listen to them? And if they have pain, address their pain. Like one of the mothers said that she had a lot of pain, but the doctors didn't seem to, hear her. I just want the Black and brown women to be treated with respect. And while you're providing them the education.
Training in our 49 labor and delivery hospitals. So I think, I'm gonna let Dr. Rowley add on to that, but that's just a piece of the puzzle.
Yeah, one of the three main approaches in the plan includes creating an equitable health system. So it's not just the doctors who need implicit bias training. The institutions that deliver health have to make changes. And so the plan includes a playbook for getting things done in the first year. And within that, there are a series of recommendations for how to address bias in the healthcare system. But there's structural racism in the healthcare system, just like in all other parts of the society we live in. And I want people to feel comfortable saying structural racism needs to be addressed, not just educating the providers. And to be honest, I've reviewed the literature. There's very little evidence in evaluating implicit bias training that it makes a big difference. And that's why there's a lot more that needs to be done that's included in the plan in terms of changing behaviors of the providers and changing the institutional policies in the healthcare system.
Thank you. Thank you so much, Dr. Rowley. Okay, Shannon, do we have any other questions?
Yes, our next question is going to come from Cecilia Zalkind from the, hold on one second, I'm going to unmute you, Seal. Okay, she's unmuted.
Good morning. Can you hear me?
Yes, we can.
Great. Good morning, Mrs. Murphy. And thank you for your very innovative and dedicated leadership on this issue. Your leadership led to creation of the doula program in New Jersey. And I know that this plan expands other innovative services. My question is two parts. One, how will these services be coordinated? And more importantly, how will we make sure that pregnant women know that they exist?
Thank you, Celia. So we will be taking on a Nurture NJ coordinator who will be focused on coordinating policies and programs across state agencies, community organizations, business leaders, hospital systems, and most importantly, ensuring we are hearing from and including moms and families in every single conversation. Does anyone else want to add anything there? Okay. Celia, I hope that answered your question.
Thank you, it does.
Okay, First Lady, next we're going to be hearing from Emily Baggett from the Trenton Health Team. Emily, I'm unmuting you now.
Hi, and thank you for this, this wonderful plan. My question is, given the numerous recommendations that pertain to certain state agencies like DOH and DHS, how will those agencies prioritize what to get to work on first or what to direct resources?
We perhaps will carve out a piece of that funding and enter into a contractual relationship with another department. I think that in terms of prioritization, the Murphy administration has made at the top of our things to do list, dealing with and addressing the wealth gap that exists in New Jersey and the divide that exists in terms of the incomes and living conditions and economic equity between Black and Brown populations and everyone else. I'd include the Department of Labor that we work with, because the Department of Labor also can bear responsibility for narrowing down that wealth gap that exists, because all of these things have something to do with the ability of Black and Brown families in New Jersey to improve their access to healthcare. So I would say it's through the relationships and the interdepartmental memorandums that we have with one another that we prioritize these things. But this is on everyone's radar screen in each department of our state government.
Thank you. Another thing that I should throw out there, just so everyone is clear, when we started with this whole analysis as to how we got to this terrible place in New Jersey, I will tell you that we had two departments and agencies within the administration who were working together with us. Roll the tape forward, and here we are 3 years later. We have 18 different departments and agencies who are actively engaged in working with us. And it's department and agencies you would never have guessed. Obviously, DCA is a critical partner, so having Sheila involved is incredibly important. But I will tell you, we have everything from the Department of Environmental Protection. We have Department of Banking and Insurance. All of these different departments play a critical role, and we are really coordinated, but it will be fantastic to have someone who's going to oversee the entire plan for us. I think, Shannon, unless you tell me otherwise, we don't have any more questions.
That's correct.
Okay. Well, I just want to reiterate my thanks to Sheila and to Bonnie and to Diane and Nastasia And Ajane, thank you so much for being here and sharing that incredibly powerful story. To each of you who joined us today, grateful for your commitment to our moms and babies, and thank you so much for your partnership. We are not going anywhere. We've got a lot of work to do, and we're going to be relying on you to stand shoulder to shoulder with us and help us bring our community level engagement to the table, if not be the building block upon which we all will figure out how we move forward. So thank you. Thank you. Have a great day. Stay safe. Stay healthy.